Good afternoon, Mike Jones, Fire Chief, City of Fredericksburg, here with your COVID-19 update for Friday, May 29th, 2020. Let's talk about the statistics first. The number of positive cases that increased since yesterday is a total of 29. We also had 5 new hospitalizations. We now have a total cumulative since the beginning of 1,448 positive cases in our health district, which includes the 4 counties in the city of Fredericksburg. Fredericksburg alone has 147 cumulative cases. Stafford leads the way at 681. Spotsylvania has an even 500. King George is 62, and Caroline is 58. The positivity, number of people that test positive versus total number of tests given. In the Rappahannock region, the positivity rate is 14.3%, which is up 0.3%. Not a lot, but up a little bit based on the number of tests that were done. Yet last reporting period, they tested over 400 people, so our testing is ramping up a little bit. Statewide, the actual positivity rate is down. It's down to 13.4% and has been trending down for a little while now. We'll go ahead and put the numbers from the Commonwealth of Virginia and the United States on our written report we put out this afternoon. A lot of concern and questions about face coverings and masks and things like that based off of the governor's requirements for wearing face coverings inside public buildings and things like that. I have 2 face coverings here. One is a cloth face covering, and the other one is a simple dust mask. Either one of them will meet the requirements of going into a public building, whether it be a brick and mortar retail or a salon or barbershop or things like that. And what I'm going to attempt to do now is give you a demonstration of the proper way to put it on and take it off, what we call in the industry donning and doffing the information. Both of these masks, the simple dust mask and then the cloth face covering, neither one are considered personal protection equipment. So you don't need specialized training. You don't need to have a test fitting done or anything like that to wear either a cloth face covering or a dust mask, anything like that. Only when you get to your N95 and higher respirators that are primarily used by first responders do you need to have any consideration of fit testing or things like that. So let's talk first a little bit about the dust mask. It's pretty simple. It's a single ply piece. You can buy these at any home center or anything like that. A lot of times they're used if you're demoing your kitchen or bedroom or something like that. You're putting in drywall or taking it out or anything like that. It's a simple piece. You'll notice the top has a little metal band onto it so you can conform it to the nose. And the easiest thing about that is it just has one little elastic string. What you want to do is you can grab it from the outside. Make sure you've washed your hands first. Make sure this is clean. It should be a one-time use only. Once this thing becomes soiled, what you need to do is just take it and throw it away and get another one. You can buy these in boxes of 10 or 15 or 20 at a crack. So once it becomes soiled on the outside, get rid of it. Start with a fresh one each time if you're going to go the route with the dust mask. But it's pretty simple. It just comes on. It comes right up to your face. Run your elastic over top of it. You can put it above your ears or below your ears around your head. And then just make sure you pinch this down on your nose. Notice that it covers the nose, it covers the mouth, and it covers around the chin. So it covers all the areas that you would need to have covered to meet the requirement of Executive Order 63. When you're ready to take it off, grab the elastic here. Again, you want to try to have clean hands and everything like that, and then just pull it away from your face simply like that. And at this point, you can discard it and get rid of it. If you're going to use one out in the yard or something like that, say you're cutting grass, it works perfectly fine for that. You just take it off and on. But that does meet the requirements of the Executive Order 63. The next one is a cloth face covering. I'd like to thank Counselor Carrie Devine. She made this for a lot of people in the fire department. It is 2-ply. Notice it's got the baseballs on the exterior side, so you can see that, kind of related to the Fredericksburg Nationals a little bit. And then on the inside is the green color. You want to make sure when you pick this up, you pick it up by the elastic pieces. Hopefully it's been somewhere where it's been cleaned, it's been kept in a paper bag or a plastic bag or something like that where it's not going to get exposed to dirt or anything like that. You take this, basically grab it by the elastic pieces, and you'll notice that it kind of has folds into it. You kind of want to put that over your nose, bring it down. Go around your ear. I know it's kind of hard to hear. Make sure you've got it on your ear, and then just pull it down like that. Notice again, covers my nose, covers my mouth, covers my chin. When you get ready to take it off, this is the area that could have contamination on it, the exterior side. So again, wash your hands and everything like that before you take it off, and then grab it by the elastic strips, and then just gently pull it away, just like that. Put it down someplace, This type of face covering, unlike the dust mask, can be washed, and it should be laundered every day. So you might want to get a couple of these if you're going to go out every day into businesses or things like that, but you can do this. If for some reason you sneeze or cough into it or anything like that, you probably want to take it off as soon as you can get away from it, put a fresh one on if you've got to go back someplace else, and then have that laundered. But you can use these over and over again. The elastic is usually pretty tough. Sometimes there are rubber bands that come with certain ones that you have that aren't quite as strong, but they should work out as well. But if you have one of these face coverings, and that's exactly what it is, it's a face covering, it's not a piece of personal protective equipment, they'll work very well from there. So let's talk a little bit more. For residents and with additional questions or concerns about the face masks or things like that, what the state is asking is that you call their COVID-19 hotline. That is 1-877-ASK-VDH3. That's 1-877-ASK-VDH3. Do that rather than calling the local health district. We have some challenges at the local health district right now, being able to have enough people to answer the phones and things like that. So we want to make sure that you get the most available information and the most up-to-date information, and that's available through the state COVID-19 hotline. Some concerns about information related to what's going on. VDH will take an educational approach by advising the public and businesses of the requirement to wear face coverings. So again, as the governor mentioned, the intent is not to issue you a summons or take you away in handcuffs. That's not the idea. The idea is to get voluntary compliance by using an educational component. So that's what they're going to talk about first. Whether that comes from the business owner or that comes from somebody at the Virginia Department of Health, they're going to try to make sure that you're educated, you know what the executive order says, and you know what they're looking for. VDH will only take action on willful, egregious violations of the order. In other words, you're doing it on purpose and you've done it multiple times. The Northern Administration and VDH wants Virginians to do the right thing and wear a mask to help curb the spread of COVID-19 to protect public health. So the idea is to get voluntary compliance, do the right thing, do it for your friends, do it for your loved ones, do it for your neighbors. Phase 1's success hinges on everyone wearing face coverings in public settings. So again, everybody as of today is in Phase 1 in the Commonwealth of Virginia. We'd like to get to Phase 2, maybe as early as next Friday. We don't know for sure. We'll find out from the governor next week. But everybody's in Phase 1. But part of the reason and making sure that we don't spread the infection and don't have problems is by wearing the face coverings. Face coverings should be combined with other preventative actions such as hand washing, social distancing, and disinfecting frequently used surfaces. All the things that we've talked about since the very beginning of these videos. Washing your hands, vigorously for 20 seconds using good soap and water. If you don't have soap and water available, then a hand sanitizer with at least 60% concentration of alcohol. We've talked about the social distancing, about staying 6 feet away from others, not congregating in large groups, things like that. And then disinfecting using, wipes or some type of bleach or disinfectant wipes on highly touched surfaces such as countertops and sink areas and things like that, doorknobs, handles, all those type of things. So finally, remember, it's Friday, supposed to be a really nice weekend out there. Take advantage of the good weather and get outside. Use our parks and trails. Visit the farmer's market on Saturday. Make sure you have your face covering. Or just enjoy the sunshine, the nice weather in your yard or your neighborhood. Remember to wear your face coverings when inside businesses or around small groups and practice good social distancing. We'll talk again next week. Thank you.